Seniors, be aware, these 9 everyday medications could be harming your memory. Are the pills in your medicine cabinet quietly damaging your brain? If you're over 60 or care for someone who is, this could be one of the most important videos you watch all year. Today, we're revealing 9 everyday medications prescribed to millions of seniors that are linked to rapid memory loss, brain fog, and even dementia-like symptoms. These are not rare or exotic drugs. We're talking about over-the-counter meds, common anxiety treatments, and sleep aids. So grab a notepad, stay with us, and let's protect your memory before it's too late. Welcome to Health Consistency, your trusted space for smart, science-backed health advice for seniors and caregivers. Subscribe and hit the bell so you never miss life-saving information like this. 1. Why medication matters for memory health. Are medications secretly fueling dementia in seniors? As we age, our bodies process medications differently. What worked well in your 40s might suddenly affect you in new, unexpected ways in your 70s. Many seniors are prescribed multiple medications, known as polypharmacy, to manage chronic conditions like high blood pressure, arthritis, anxiety, and insomnia. But here's the problem. Some of these medications affect the brain's ability to function properly, especially those that interfere with neurotransmitters like acetylcholine or GABA. These chemicals are essential for memory, focus, and mood regulation. Now, let's dive into the 9 most common medications that could be contributing to cognitive decline and what you can do about them. 9 medications that may cause dementia symptoms. 1. Anticholinergics. Examples: diphenhydramine, Benadryl, hydroxyzine, scopolamine. These medications block acetylcholine, the neurotransmitter that helps the brain send messages. Acetylcholine is vital for memory and attention. Long-term use of anticholinergics has been associated with a significantly higher risk of dementia, according to multiple studies, including those published in JAMA Internal Medicine. Common uses: allergy relief, motion sickness, sleep aids. Alternatives: second-generation antihistamines like loratadine, Claritin are often safer for seniors. 2. Benzodiazepines. Examples: Xanax, Ativan, Valium, Klonopin. Used for anxiety, panic attacks, and insomnia, these benzos slow brain activity. But they can also increase confusion, drowsiness, and short-term memory loss. Studies suggest that long-term use may double the risk of developing Alzheimer's. Especially dangerous when taken regularly over 3+ months. Alternatives: cognitive behavioral therapy for anxiety, melatonin for sleep. 3. Sleeping medications. Examples: zolpidem, Ambien, esopiclone, Lunesta. These Z-drugs can help people fall asleep, but they affect brain waves, often leading to confusion, grogginess, and memory impairment, especially in older adults. Sleepwalking, hallucinations, and sleep driving have also been reported. These are not recommended for long-term use in seniors. Alternatives: sleep hygiene practices, magnesium supplements, guided sleep meditations. 4. Tricyclic antidepressants. Examples: amitriptyline, nortriptyline. While effective for depression and chronic pain, these drugs also have anticholinergic effects, putting seniors at increased risk for cognitive decline. Often overlooked because they're prescribed for pain, not mood. Alternatives: SSRIs like sertraline, Zoloft, which have fewer cognitive side effects. 5. Antipsychotic medications. Examples: risperidone, Risperdal, quetiapine, Seroquel. Commonly prescribed to manage agitation or sleep issues in dementia patients, but ironically, they increase stroke risk and worsen cognitive decline. The FDA has issued black box warnings for use in dementia patients. Alternatives: non-drug behavioral therapies or medications specifically tailored for dementia care. 6. Opioid painkillers. Examples: oxycodone, morphine, hydrocodone. These powerful drugs dull pain, but also dull mental clarity. Long-term opioid use has been linked to memory loss, mood changes, and dependence. A major concern for post-surgical seniors or those with chronic pain. Alternatives: physical therapy, acupuncture, non-opioid pain relievers. 7. Statins. Examples: atorvastatin, Lipitor, simvastatin. Why it's concerning. These cholesterol-lowering drugs have conflicting studies. Some show memory loss, others don't. But some seniors report brain fog, confusion, and short-term memory issues. If you notice changes after starting statins, don't stop abruptly, but speak with your doctor. 8. First-generation antihistamines. Examples: chlorpheniramine, diphenhydramine, Benadryl, hydroxyzine. Why it's concerning. Common in allergy and cold meds, these can severely impair cognitive function due to their anticholinergic effects, especially in older brains. Many seniors take these over the counter without realizing the mental cost. 9. Bladder control medications, antimuscarinics. Examples: oxybutynin, tolterodine. Why it's concerning. Designed to help with urinary urgency and incontinence, these drugs affect the same receptors in the brain responsible for memory and attention. Safer, non-drug alternatives like pelvic floor therapy should be discussed with a healthcare provider. What you should do next: don't panic, but be proactive. If you or a loved one are on any of these medications, don't stop them abruptly. But do take the next step. Whiteheavy schedule a medication review with your doctor or pharmacist. Whiteheavy ask about safer alternatives or lower doses. Whiteheavy keep a medication log and note any cognitive or mood changes. Whiteheavy consider working with a geriatric specialist for tailored advice. Have you or a loved one experienced memory issues while on any of these medications? Share your experience in the comments. Your story could help someone else avoid the same problem. If you found this helpful, please like, subscribe, and turn on notifications. We post weekly videos that help seniors stay informed, independent, and empowered.